So I think the next one is very important, and it's widely abused out there. And I think it's very important that we all discuss it. Human growth hormone. We know you're an expert in it. Let's start by debunking the first myth, or maybe I'm wrong, but I think it's still a myth because I haven't seen the research, that human growth hormone causes cancer. Right. And what are your thoughts of using growth hormone secretagogues as an alternative? How do you use them? Because we're big on peptides, especially because the regulations behind prescribing human growth hormone are pretty rigorous, and most people are prescribing it like if it was a kid in a candy store. Like we've heard so many people that are getting prescribed growth hormone with no problem, no tests, without even checking an IGF-1.
Right.
Okay.
That's
a lot to unpack. That was a lot to unpack. We kill 5 questions in one.
Okay. So the reason why they believe that growth hormone will either initiate a cancer, or if you have a hidden cancer, to cause it to propagate, to grow and become a problem, is because they only look at one aspect of growth hormone. Now, growth hormone will tell the liver to make 9 proteins. Of those 9 proteins, there are specific hormones like IGF-1 and IGF-2. Those are hormones that do increase the quality of cells to replicate. And their belief, stopping looking at just that, is that this, it's called promitosis, where the cells will replicate under the influence of IGF-1, that is the reason why you'll have possibility of increased cancer. Why? As cells replicate more, the possibility of damage to the DNA and mutation increases. So it replicates, but they never go to the next phase, which is looking at the 7 other proteins that are made by growth hormone in the liver, which are called binding proteins. And there's a binding protein 1, 2, 3, 4, 5, 6, and now a 7th one. And they never look at what the science is talking about these binding proteins. Well, it turns out that binding protein 3 and binding protein 4 are anti-cancer. And how do we know? The Melbourne Collaborative study out of Australia showed that people with terminal cancer of the colon, that when their level of binding protein 3 was elevated in a high normal range, that they were 48% less likely to die from their cancer than the group with lower levels. And then they found another one, binding protein 4, which also helps with colon cancer specifically. So if you only take and look at one portion of the influence of growth hormone on the chemistry of the body, you say, yeah, it's increased risk of causing, cancer or propagation of cancer. But when you look at the entire influence of growth hormone on these chemicals, you see that there's a balance. Whoever designed our growth hormone system, which is very, very complex, incorporated protective mechanisms. And in fact, this binding protein 3 works in the nucleus where the mutations occur that lead to the cancer. It works with a compound that's called P53, which is the most important anti-cancer product in the body. But then you will ask, then why is there so much cancer going on? It turns out that this P53 needs zinc. It needs zinc. And zinc is deficient in about 1 billion people worldwide. So if you put zinc into the system, which also blocks SARS, it also blocks influenza A and B, it also helps with dementia and with cancers through that mechanism. So we need to put zinc back into the system. Zinc's involved in about 300 processes in the body. Anti-SARS 1 through 9, influenza A and B, anti-cancer, anti-Alzheimer's. It helps with sperm production, with testosterone production. It helps with a system in the brain to stop inflammation, which is called a SOD system, which is superoxide dismutase. Zinc's extremely important.
Superoxide dismutase.
You're not going to be
Dismutase.
That's why I know
it's SOD. SOD system. Zinc's very important for lowering inflammation. So that is the myth behind how growth hormone causes cancer. In using growth hormone, which for me, and I'm not an expert in anything, I'm well read.
There you go.
Okay? I let other people.
I
let other people to be the experts. I'm not the expert. So the growth hormone for me since 1997 is the number one hormone that we have to check on to make sure, because it influences all our other hormones. In fact, growth hormone will influence thyroid hormone. So if you're deficient in growth hormone, you might not have the thyroid hormone called T3. You will have T4, but you need T3, which is the activated form. And what does it do besides the body fat and metabolism throughout the body? It helps with stem cells in the brain so that it helps with repair of the brain. So it's an area that's very important to us with traumatic brain injury. So growth hormone is a very important hormone, but before we'll use an expensive injectable growth hormone, not the things that stimulate growth hormone like the secretagogues, CJC, ipamorelin,
the GH,
semaglutide,
and
the GH, right, the precursors.
Precursors.
We don't use that. What we use are secretagogues that are natural stimulators. And there are products out there which will stimulate your own growth hormone production through 5 pathways, as opposed to most of those that we just talked about only go through 1 pathway to stimulate growth hormone releasing hormone. But growth hormone is extremely important for anti-inflammation. There are tons of articles on how it improves personality, emotional stability, drops inflammation, helps with neurogenesis. In fact, the binding protein number 6 helps with what they call neurogenesis, to generate new nerves. I mean, through our education, we were told that once you lose a nerve, you can't grow it. It's no longer the case. You can regenerate it and generate a neuropermissive environment where the brain recovers, where the brain wants to make neurons, better communications.
Yeah. And that's huge with the nerves, because there's people, especially with traumatic brain injury, that get spasticity and they lose mobility, right?
Well, we have patients with strokes, multiple sclerosis, Parkinson's, Alzheimer's that have improved from protocols that include growth hormone or IGF-1.
Right.
So, again, your brain works so amazing. So the short answer to does HGH cause cancer?
No.
Yes.
No.
And you
doesn't. No.
The way I kind of knew this without knowing all the backdrop of the physiology is they give HGH, growth hormone, to patients with HIV and AIDS.
Yeah.
So if you have wasting disease from AIDS, your insurance will actually cover your HGH medication. AIDS patients have a high risk of cancer. If HGH was going to cause cancer, it would have caused cancer in that population.
Right.
They would have not given it
Very
to the
easily,
patient.
too.
And we see them in South Beach. A lot of the AIDS patients, you see them all swole.
Yeah.
They're taking HGH.
Yeah.
They're selling half of it
Yeah.
right, on the black market, and
They
they're
are.
taking it. So really great explanation. HGH is definitely part of the cascade. It's never one thing when it comes to hormones.
Right.
It's never just testosterone, never just DHEA, never just pregnenolone. It's when you get the balance of the hormones.
It's interesting that you say that, because a lot of times they see doc, then they talk to us and they become completely different people, right? Like they think that we're trying to sell them something. And I simply say to people, I'm like, look, your health, your hormonal health, your endocrine system, it's like a beautiful symphony, right? And you're hiring me to be the conductor of that symphony. Now, if you're just gonna tell me that you only want me to work with the drum section, well, you're not gonna get I'm not gonna be able to deliver a symphony. You're gonna get a drum circle, and those things are kind of weird, right? So
Absolutely. I like your analogy.
Your drums usually testosterone.
all the one is the testosterone.
The way I like to
love
say
that.
it, testosterone is the LeBron James of the team.
Right.
You need your role players.
Right.
You need the surrounding support.
Correct.
That's
So
right.
really good.
Well, the analogy, that's a great analogy with the symphony. I've heard it before, but I like the way you present it.
With the drum circle.
The drum. I got it. The percussive section. So the analogy I use is the automobile. You're, the driver in the automobile, and think of all your tires flat. So you got the 4 tires there, and you've got the spare tire. They're all flat. And I ask the patient, okay, what tire do you want to fill? You want the testosterone tire? You want the growth hormone tire? You want the thyroid tire? You want the DHEA tire? And the spare tire of vitamin D? Which tire do you want? Well, I guess I got to fill them all in order for me to drive through life
That's
nice
really
and
nice
level,
analogy.
right?
Look at this.
So if
I'm
you,
gonna steal that one for you.
I know.
you
We'll
can
steal
do
that.
that as well.
I heard that in a lecture. I don't know if it was
Yeah,
you.
yeah.
It was definitely him.
I
Definitely him.
did
Probably
on
you.
quiet explosions, yeah.
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 Well, I think that's a great segment to talk about. One other thing I think is one of the wheels.
Right.
And where we find it's a little difficult to explain to patients the importance behind supplementation.
Right.
Because today,
Before we go there, can I ask you a question? Are you going to ask him about the growth hormone shutdown?
I wanted to avoid that question because that can go down a rabbit hole. But
No,
if you want to
let's
ask
go with
it,
the
we
valid
can.
ones.
I honestly was thinking in my head.
Here's the thing.
Okay,
Within
you
48
can.
hours, it shuts down growth hormone.
Yeah,
by
I don't know if to
40%.
talk about that.
Okay. So do you see that in your patients you just have to use it long term at low doses, or it's a commitment?
Cycle. See, since you brought it up, I'll try to stay out of that specific hole, but I'll go through the superficial one just to keep it so it's known. Yeah.
Thank you.
We think that, not my thoughts, but as a generic population, we think in general that when you use a hormone or use a chemical today and stop it tomorrow, it's gone. Well, it turns out that we have to look at our hormones from the standpoint of how much is left in the blood, as well as how long the effects are on our cellular functioning. So it turns out in research that was done on the inside the cell, intracellular effects of growth hormone, after you've used it, it lasts for 8 to 12 weeks. So we have patients that cycle on and off their growth hormone every 3 months. They're on for 3 months, off for 3 months, on for 3 months, off for 3 months. And we also use a secretagogue concurrent to their injectable to keep the tone, to keep the functioning of their own production going.
Is that how you keep the IGF-1 on?
That's how you keep the entire circuitry on.
I see it.
Okay.
Okay.
So again, within 48 hours, you have a 40% reduction, and within 30 days of using growth hormone, you're shutting down your complete entire production.
Correct.
But you cycle it on and off with this secretagogue solution in order to help you keep the effects going.
You keep the secretagogue going and you use your injectable growth hormone on top of that. Now, it turns out that when you have the secretagogue, and then you use the injectable, you need less injectable to achieve a higher level of growth hormone. Because think of it this way: if let's say you're making
all the little components,
if you're making 100, sorry for tapping there, if you're making 100 units of growth hormone naturally, and you no longer shut it off, you still have that 100 units being made, or the 100 nanograms, and you add to it a shot, 1 unit or whatever, it adds to what you have in your system instead of wiping out your own production. And all the injectable is reestablishing the availability of growth hormone. So you're not wiping it out, you're just adding to it. You're
no, and it sounds like
the
you're
true
giving it
term.
the other substrate because you're getting IGF-2, IGF-3,
Well,
you're getting the other ones as well.
generate those from the liver. When you inject growth hormone, it's the growth hormone in the liver that turns 75% of these 10 other proteins are generated in the liver.
Okay.
And something really important for growth hormone, which is a big problem I have, restorative sleep. How amazing HGH is to help with sleep.
Absolutely.
And again, as you were saying, for a lot of patients with growth or with TBI, with hormonal deficiencies, sleep is one of the major problems.
Big one.
Absolutely.
So doing the right supplements like magnesium, pregnenolone, and some kind of secretagogue cycling
Zinc.
with HGH.
Right.
That's a great comment.
Yeah, and the benefit of growth hormone and sleep, which I love because I sleep solidly for my usual 5 to 6 hours. And the reason is because it drops inflammation. And there are about 54,000 articles that talk about insomnia being caused by neuroinflammation in the brain.
Wow.
And growth hormone, what it does is it modulates the production of the inflammation, so it lowers the inflammation. That's part of the benefits we get from using growth hormone in traumatic brain injury or people with a inflammatory brain or non-neuropermissive brain.
Interesting.
Amazing.
Well, before now you make me add a question.
Okay.
Peptides for nootropics for fixing the brain. Do you use like cerebralizin, FGL, dihexa, C-Lang, C-Max?
The C-Max is great in our population of veterans that have either persistent or very deep neurological issues, whether or not it's cognitive or emotional. We'll put them on C-Max 1 milligram a day and see great responses, or a new one, ARA 290, which is another improvement of the neurocommunication, drops inflammation, stimulates neuroregeneration, helps with the communication between neurons that are called synapses, so it's called synaptogenic, which it generates. Genic means to generate these communications. So people wake up and say, whoa, you know, they're much better.
I might try that.
Yeah. The CMEX is really nice.
Yeah, I love that.
Yeah,
It's
we
one of my
trust me.
favorite.
He's huge on nootropics.
Yeah,
He eats
it's
gums, puts
cost
creams, shampoos with nootropics. He is insane with nootropics.
He's
Don't
like,
tell him
he
too
wants to
much.
do the calm ones. I want to do the
Yeah.
nootropics.
Yeah.